Welcome to the Vocation of the Business Leader podcast. I'm Greg Balstert. Here we explore how Catholic leaders let Christ and the teachings of the church he founded guide their work, integrating faith and business. Each episode offers inspiring stories to help you live an undivided life. Thanks for joining us. Let's meet our guest, Daniel Cruz, co-founder and CEO of Presidio Healthcare. Welcome, Daniel.
Thanks, Greg.
Would you
Thanks for
please
having
tell
me.
us a little bit about yourself?
Yes, so I am a Catholic husband, father of 4 wonderful children. As you can see, we got like a little crib here. We're sleep training our youngest, who is just turned 6 months, little Felicity. So first and foremost, that's my faith is the most important thing to me as a father and husband. Professionally, I am a healthcare actuary, pricing actuary. I've been and if for those who don't know what a healthcare actuary is, actuaries are the ones that manage the risk for insurance companies. Often we're the ones that price and develop the products in the insurance landscape. And so I've been working really since the Affordable Care Act came out, since about 2013, in the health insurance space. Worked for some health insurance companies as a consultant and done a lot of work on the federal policy landscape, as well as state Affordable Care Act policy. So that's my background. And of course, newest venture, last 2 years, I've been working with my great co-founder, Bob Hogan, who's a healthcare lawyer, in building the nation's first pro-life health insurance company, fully aligned with the Catholic faith, something really unique in the marketplace, trying to get, pro-life families great health insurance coverage that they can trust, something that aligns with their values, but importantly, something that they can trust putting their families on.
Yeah. So could you just kind of touch on the highlights, because otherwise we'd be here all day, on how the current health insurance industry is broken?
Yeah, so I'd like to look at the healthcare industry kind of in 2 lights. One from the faith perspective, and then one from the economic perspective, which from the economic perspective also actually influences how the benefits that are covered under healthcare violate the faith. So these things are interrelated but 2 separate. So on one hand, I'll start with the religious component. Ever since the Affordable Care Act, which was people know it as Obamacare, it's one of the most influential federal policies on the healthcare landscape that we've seen, impacted almost every market in America. The Affordable Care Act forced every single health insurance company to cover contraception and abortifacients. So this is known as the contraceptive mandate. Additionally, states across the country have mandated abortion as a benefit that has to be covered if you purchase insurance. So effectively, the most important thing, the biggest thing that's broken in healthcare is that it doesn't honor the dignity of the human person. If you're paying for insurance, which 93% of Americans are currently insured in one way or the other, you are likely paying for services that violate the dignity of the human person. So obviously, healthcare being something that is near and dear to our Lord and Savior, like most of his miracles were restorative health miracles. It's that sign that points to our ultimate spiritual restoration is these physical restorations, and we participate that by helping heal the sick. Obviously, this aspect of society that should be under the control of the church, that should be guided by the church, has gone completely astray in the United States, and in fact works against the principles of our faith and against the dignity of the human person. So that's, I would say, the most obvious, biggest problem that we face as a country on the healthcare side. Now, directly related to that is really why the federal government has been able to control healthcare, which is that we have a major problem and generational, decades-long shift to more and more centralized control of the healthcare system, meaning who ultimately has the dollars and decides what gets paid for in healthcare. So vast majority of the United States healthcare system is run by the federal government. So you got Medicare, covers everyone over 65. Medicaid, covers everybody who's under, 138% of the federal poverty level. Obamacare, which is now up to over 20 million people, gives federal subsidies for the vast majority of people there. And then the least amount that it touches, but still touches the employer market, where, your employer pays for your coverage, gets tax advantages to do that, but still the tentacles are there from the federal government through Obamacare that still mandates what employers have to cover. So I would say that the biggest problem of centralized control of a program, which is, the reason why most of these programs exist, is to try to help people get access to care that can't afford it. So there's some good reason why we want to get Medicare involved or Medicaid. What happens ultimately is that a small amount of people then get to weaponize that and use that to force certain benefits to be covered by everyone. So that's what the contraceptive mandate was downstream of this problem that we have in healthcare, which is how do we get people that can't afford healthcare access to life-saving healthcare? A solution of that is federal control to cover those benefits and services. But when you centrally plan a solution to a problem like that, people come in and weaponize it to then say, oh, we're going to help poor people get access to coverage, and at the same time force everybody to cover contraception, abortifacients, and in some cases abortion. So I'd say one of the most important things as Americans and as Catholics that we need to focus on going forward is, how do we disentangle healthcare from a centrally planned environment like, these federally run programs that have been weaponized? And so that's been a lot of my work before Presidio, was working really in the healthcare policy sector of how do we make things more free market? How do we institute subsidiarity within healthcare, make, families be the ones making decisions in healthcare? You should be purchasing your insurance. Someone shouldn't purchase your insurance for you. That's kind of starts the problem. And so that's, probably the secondary passion is, if we get more individual control of healthcare, you're going to get less federal control, less, violations of, the dignity of the human person, which will allow organizations like Presidio to exist and multiply and really, serve families in the way they want to be served.
Right. So how is Presidio going to address these areas?
Yeah, so there's really two ways. The first is to focus on where have the pro-life solutions existed to this point. So the only pro-life type of healthcare option that we have today are something called health sharing ministry plans. Mm-hmm. These have been growing in popularity over the last 10 years. There's been a 10-fold increase in people joining these plans. They're great from the pro-life standpoint. They're great Christian organizations, but they're not legally health insurance. So you have to take a risk for your family to jump on them, because there's no legal protection that they'll actually pay medical bills when those bills come. And those bills could be $1 million, right? These are bankruptcy type level of issues. So the first thing is to offer a product that is both pro-life, but is 100% insurance. So you can trust the fact that we're actually going to pay your medical bills, remove the risk of jumping on a pro-life option, and so that you can trust both the values and the actual coverage. So we are launching in Texas in 2025 to really have that first pro-life health insurance option in this kind of alternative, non-Affordable Care Act, non-Obamacare marketplace. The second thing is that there is this little known reality that in 2018, the Trump administration expanded religious exemptions to the contraceptive mandate. So the contraceptive mandate touched every organization in the country. The Supreme Court gave Hobby Lobby a victory over the contraceptive mandate and said faith-based employers don't have to cover things that violate their faith. And the Trump administration took the next legal step to say, well, if employers have this exemption, health insurance companies should have this exemption. And so they created a new category, a new class called faith-based health insurance companies. And so we are literally the first company in our nation's history to file our license as a faith-based, specifically as a Catholic health insurance company. So what that allows us to do long term is, with those religious protections, we can then offer Obamacare, Affordable Care Act, traditional health insurance coverage that's fully exempt from the contraceptive mandate. So that is this is a long-term, this is a needed project. This is something that the church really needs to lean into, because, if you don't build the organizations that protect the religious liberties, you're going to start losing them. So we really see this as something that probably should have been built as soon as the Affordable Care Act was started. But, as it would happen, God has called us at this point in time to do it. And that 2018 rule was really the push for that.
Yeah. So you have been in the health insurance industry for a long time. How long have you been pondering this solution?
Yeah, so I would say I've been working in the healthcare space since 2013. I worked for a company called U.S. Health Group back in the day, and they were kind of pioneers in the non-ACA space. And I would say, I was totally blind to even thinking about my job, my career in terms of abortion. It didn't even, I didn't even think about I'm entering in the healthcare space. This might touch abortion. It just wasn't something that was part of my thought process. I would say the very first time this kind of peaked up was I was an analyst at U.S. Health Group, and someone asked about abortion and well, if we covered abortion, what would that do to our costs? And an actuary there at the time said, well, if we cover abortions cost $500 and a birth costs $25,000. So we'd probably save money. And I had this incredible, a huge pit in my stomach of whoa, I didn't even think. And he didn't, and this guy wasn't trying to make he was just trying to be matter of fact about the reality of it. But it was the first time that I realized I'm in an industry that applies math to these numbers on a spreadsheet. These people that I'm calculating their costs are just numbers on a spreadsheet. But in reality, what we're talking about here is real life. And you could have this cold-hearted sense of literally it would be more advantageous for a health insurance company to abort a child than to take care of the child. And so that was the first time. And I rushed in and I looked at all the files for the company, and I made sure that we didn't cover and they don't cover abortion. So I went through, I was like, great, these guys don't cover abortion. And I kind of let that go. It didn't really come back full circle to me till many years later. About 3 or 4 years ago, I was at a prayer event here at my local church called a May Crowning event every May 13th. It's a beautiful prayer event celebrating Mary as Queen of Heaven. And I was at that event with my family. I was leaving that event, and I get to my car. I look at my cell phone, and the first email that I see is from a client that I was working for at the time that said, hey, Daniel, can you calculate the cost of abortion for our health plan? And so it was the first time that I was actually directly asked that question. It was right after this beautiful prayer event where I was worshiping Christ as King of the universe. And it was this moment where it felt like such a clear punch in the face, saying you claim to say Christ is King, but in reality, you're working for the devil. You're bowing down to the Prince of Lies here. And that's how you're making your money for your family. And so my wife and I had to sit down. My wife is, she is, the primary caregiver of the kids. She's a homeschool mom. We have one income under myself. So we were okay, let's sit down, discern, let's carefully pray about how do we remove myself from the evils of healthcare, but go towards the goodness. Actually you have my services do something, that promotes the dignity of life. And that's really where I got introduced to these health sharing plans. Was one of the bigger ones was a client. We landed them as a client right after that event. And I was like, all right, this seems like where the Lord's taking me. I would love to make these health shares run more like insurance companies. But quickly after that, as I started doing more research and started exploring other organizations, I saw there was a huge problem, which is some of these organizations are terribly run. And that's a big problem for families, because you're playing Russian roulette with your finances. If they don't have the money and you just went on their plan, then something happens, like you have no recourse legally, and you could be stuck with a big issue. So that's kind of the full circle of how I found myself kind of solving a problem for myself, which is I wanted to work for these organizations, but I couldn't find an organization that was both like pro-life, but also like actually delivering a great product. And so, because I couldn't find anybody to work for like that, I prayerfully started getting the sense from God that, like, hey, you're actually perfectly fit to build something like that. And that's where we started with the journey here.
Yeah. So I was going to ask you. So what it was like? What was it like to go, trust God completely and go all in on the Presidio?
Yeah, I would say, like, initially it was like it felt like 3 years in the making, but then all of a sudden everything happened all at once that pushed me to do it. So I didn't feel it till much later, after I truly jumped. I would say, like, out of the gates, I was doing what I always do. I've always been a problem solver. So, like, I'm fascinated by problems. Like, it was really hard for me to pass my actuarial exams because I'd be learning about Medicare, and then I would stop and be like, how do we fix Medicare? And I would, like, get into these rabbit holes of, like, trying to, like, create spreadsheets of how we could actually fix Medicare. And so it started off like how everything I've always done in my career, which is like, here's this problem, like, let me dive into how we do this solution. And I built everything, and I was like, here's the solution. I got it. Like, all of that felt normal. I would say everything shifted when I was really blessed to have Bob Hogan take a chance on me. And he jumped, and he was at a law firm, and he has 5 kids. We're all like, we're friends, like, we know each other. Our kids are all friends with each other, and I didn't really think he would jump. I was kind of recruiting him, like not really thinking, like, oh, he's actually gonna, like, go for this with me. And he did, and he put it all on the line. He believed in the mission so much, he left his job. We both left our jobs. And I would say all of a sudden it shifted from my normal, like, hey, I'm just doing problem solution like I've always done, to, like, okay, I got 2 families on the hook now, for we got to make this happen. So I would say the journey from there has been, back to your question, like, initially it didn't feel like I had to, like, trust God. I didn't really have that moment of, like, I have to trust in God, until, like, people depended on this happening, and wrestling with this, like, very difficult line to walk of, is this on me or is this on God? Like, does this take me going to every event in the world and spending all hours in the night, like, thinking through how we get investors and doing all this stuff? Or is this dependent upon faithfully, prayerfully trusting that that if God wants this to happen, like, he's going to make it happen? And I would say, like, I am not the person that has figured out that balance whatsoever. But I've been learning to, over time, to kind of, like, just trust God on, like if this is your mission, God, like, I should probably spend my mornings in prayer versus, like, LinkedIn trying to, like, message investors to start the day. Little stuff like that, like, kind of like ordering your day properly. So it's again, I'm like a huge work in progress along those fronts, but it's required more of my trust than anything I've ever had to do.
Yeah, yeah. Um, so how did you meet Bob, your co-founder?
Yeah, so we're part of a homeschool like co-op homeschool group out here in San Diego. We were just like make San Diego homeschools in the news these days. But we our wives kind of knew each other better. They were both homeschool moms, and our kids are like the same age, like they're like stacked, like his oldest and mine and this and that all the way down, so like they're all like best buds. And I got to know him through a men's like meetup. Like Saturday mornings we'd get together and talk about like work problems and just like family stuff. And so I got to know him just on a personal level, and knew he was like a deep man of faith, and that he was like a well-respected professional in the healthcare space. So I didn't really know him well, like at that point. I just knew him kind of through like church groups. And I think that's been a fun part is, we didn't really know how like our relationship would work as two founders in a company, but it's been a fun blessing to like, both him and I have like we're not the same personalities, but I think we blend very well together, and like we can understand each other's comedy and stuff like that. But more so, like there's been moments where I've totally had to like lean on him to like keep things. When there's only two people, sometimes like you need one person to kind of like be a little bit more sturdy than the other. And
Yeah.
Bob's been that in spades, so it's been fun getting to know him. And what's cool is like because we're part of the same community, like I'll see him at mass on Sundays, or like my kid's birthday party was at like the beach the other weekend, and like Bob, the Hogans are there, so yeah, that's been fun is doing this with a brother in Christ and a friend.
Yeah. Yeah. So what have been the biggest challenges of starting the first pro-life health insurance company?
Yeah, I'd say the like 100% the investor piece. So I think like I had so the biggest issue is we started off with this premise that this should look like a venture deal, that we think some people have said, oh, you do like a nonprofit. From our lens, like the for-profit structure like creates the right incentives and the right checks and balances that make sure that like we're profitable and we're growing at the right pace. And you actually want that for an insurance company. If your insurance company is not profitable, like imagine if your bank is not profitable and doesn't have the money in the bank. Like that's a problem.
Right.
Like so I think it was always the right structure. And I had a background. I worked with two health insurance startups as a consultant. So I kind of knew like, and it was like these tech guys, and I'm like, oh, if these goofballs like who don't even understand the healthcare industry can like do this and raise money, like I should probably be able to do this, right? So
Right.
I kind of just had this thought of like, hey, let's see how let's go the venture route and see what we can do. And I kind of knew the target of money that we're going to need to raise to like launch the product. But I think the challenge has been what I've learned is that the venture world is very formulaic. It's very like has a structure of its own of like typically tech driven, typically low capital. Like you have a low capital like minimum viable product. You get it out to market, you show traction, and then maybe like you can like raise some money to scale it if you have the vision for that. Whereas ours was opposite. It was like it's a higher capital lift to sell your first policy, but the minimum viable product is a insurance product. So it's a large like premium dollar, $3,000 plus annual like premium for every person that you enroll. So it was kind of this chicken and the egg um, environment of trying to explain to the venture world, investor world of why a model like this, which is kind of outside of what they typically do, can be a venture scalable type of company that can get you to $1 billion revenue, and why probably on our side timing wise, why an insurance product like ours would succeed over like a lot of the health insurance tech startups, which, I had very close knowledge of back in the day. A lot of them failed. So I think that has been the problem, and obvious. But I think the funnest thing about that is what we didn't know going into this is that there's a whole faith-based ecosystem of like, Catholic and Christian investors that, gave us an opportunity to pitch the idea where maybe we wouldn't. Like Bob and I don't come from like, Harvard or Yale backgrounds. And like, I didn't know people in the venture world, but the idea was so unique and so like values oriented that it got us to the table with people probably we wouldn't have otherwise. So in the end, like that has probably been the biggest challenge. But the beauty is we also came about in a time when stuff like Scent, like this hat up here that I'm wearing, these different organizations are looking to fund, faith forward companies at a time when I really think we need it the most, post 2020 economy, to really build things that are going to protect our values. And healthcare obviously is a big sector to do that.
Yeah. So what kind of feedback are you getting from investors and then also potential people that looking to sign up under Presidio?
Yeah, we get called all the time by folks like, hey, I'm in Missouri. Like, I can't wait for you to launch. Like, we get a lot of families that are just, they really want something that, that is a great product. So I think that, from the investor standpoint, we've gotten traction. We're going to be launching here soon. We've got great Catholic partners that believe in the mission and believe in like the business model and structure and the background that Bob and I have created. But it's more about the families, and the families are itching to have something like this. And maybe even harder than the investment piece, the struggle has been holding back that tide of people and saying like, we're gonna launch, like we're coming, like give it a little time, because at the end of the day, I think there's a lot of people that recognize that their faith is most important. They don't want they absolutely they recognize that abortion is the greatest moral evil of our time. They absolutely don't want any of their dollars going towards that, but they also have a family to take care of, and they don't like making this compromise. So if you can alleviate that compromise, it's a home run for them to say like, of course I would, purchase insurance that protects my family, but also importantly, like protects life. Like, so yeah, we're excited to launch this thing shortly here.
Yeah. So you're starting in Texas, correct?
Yep.
And then, so why Texas, and what other states are on your short list?
Yeah, so Texas is Texas. I have a relationship with people in Texas is one reason. I've helped to pass state legislation there with their Texas Department of Insurance. I know folks there, so we had connections in there. Probably more importantly, is Texas is a big state and has most of the health sharing ministry plans currently. So most of the health sharing ministry members are in Texas. So the market was just it's the best place for us to launch a product in terms of growing membership. And then number 3, it is very friendly to religious liberties as from the regulator standpoint. So we mentioned that we're launching as a Catholic health insurance company. We knew that whatever regulator is going to look at this, they're going to look at this for the first time ever. So we wanted to make sure that we had a state that, really believed in our American tradition of religious liberties that would be friendly to that type of structure. So that's why Texas. Afterwards, you can kind of imagine where the other friendly states are, a little bit of a South and Midwest. There's about 26 total target states that we're looking at. But we, I love creating solutions. I have a solution to get into California in my head that I'd like to test out to see if we can do it. Obviously, we're trying to prudentially figure out, you don't want to push the boundaries too far too early. You really want to create a strong foundation before you start taking additional risk of going into different markets. So if there's a way, we'll figure out how to get into all 50 states. But for now,
Yeah.
South and Midwest folks we'll probably serve first.
What advice would you have for other Catholic professionals that are living a divided life? Their faith and work, they keep separate, but they're afraid to change. What advice would you have?
Yeah, I would say, first and foremost, like just make the right priorities in your life. The number one thing is your vocation. If your professional life should be an outgrowth of your vocation. So if you're a father, obviously your role is to be, priest, prophet, king of the home, be there for your wife, provide for your family. If you're not there for dinners, there's an issue, right? Like we have the communion, the priest is celebrating a communal meal. Like you have to, really make sure that you're prioritizing that time with your family. So the first thing is like you get that right, and then you're faithful to God. I think that things will arise where you're gonna have to lean into your convictions. But if that is ordered correctly, like that should be a easy step to do. So like, I didn't do everything perfectly, obviously, but like in my case, like I didn't have a vision to create a health insurance company. That wasn't really my intention. My intention was to, the actuarial profession was something that really served my family well. So I was trying to do my job well. I always tried to speak the truth in my industry, and um, it presented itself as this, binary thing where I knew that if I kept down this path on my profession, even though it's serving my vocation, I'm also like violating the dignity of the human person by participating in evil, right? So it became this obvious thing of like, okay, I can't do that. I have to find a way to do it differently. But even though, maybe I create a different path that has created more sacrifices and it's been harder, like it could be easier to stick in one lane, harder for the family to do something like this. What keeps me grounded, or at least what tries to veer me on the right path, is even though you're doing something that's missionally based or entrepreneurial, or you think that there's, God's calling me to this, like if it's not ultimately serving your vocation, if it's not making you a better husband, a better father, like you're doing something wrong, or there's something disordered about it. And I think that would be my number one thing, is just remembering like your primary vocation and that your occupation should serve that vocation, because it becomes really bizarre. In a sense, it's been bizarre for me to step into a role where it's like you have a mission through your work, but you're not a priest, you're not in the religious life. Like you have to somehow make sure that just because it's mission oriented, just because it serves the body of Christ, like it should first and foremost really serve your vocation. And I think that's a huge challenge. So just being honest and reflecting on like, hey, like maybe you're a person that has taken the leap on building like a mission oriented company or whatever it is. Just trying to reflect and say like, over the last 5 months, like am I have I become a better dad, a worse dad, like better husband, worse, and just always like bringing it back to that, and not letting the mission maybe like feel like a replacement for your vocation. So yeah, have convictions, put your vocation first. That would be my biggest advice.
Well said. Well said. Um, is there anything that I didn't ask you that you'd like to talk about?
Um, not that, I mean, nothing jumps out. I mean, I think we covered a lot. I think, yeah, I think that this is just, I guess the one thing that maybe we can end on is just the importance, I think, of, I see your podcast and like the Sent movement, and just the importance of this moment in the church's life, specifically in America and amongst the lay people. I think I hadn't thought as much about it until moving in this direction. But maybe a word to anybody listening, who's thinking about creating a company or supporting a company like this is, we are entering a new time where it's tougher and tougher to be a professional and to hold your values and faith. Like the actuarial world that I come from, even the actuarial organizations are forcing more and more of some of these DEI things that are kind of pressuring you that if you want to maintain your license to work as an actuary, you're going to have to start maybe compromising your views in a public way. And yes, we're building a pro-life health insurance company where the product is going to serve people, but my hope is that equally we're there to serve as an employer. And I think we need more employers on the Catholic side that are protecting the young employees who are coming out of college so that they can also serve their vocations and provide for their families. So a lot of this that I'm doing, I think about our kids, and I think about my kids and my grandkids. And, I was lucky enough that I had a good amount of years under my belt and I made a name for myself in the actuarial world that I could take a pretty strong leap of faith and act in my convictions without totally destroying my career. But if I was 23, if I was 24, that would be a different thing. I mean, I wouldn't have any, no artillery to really fight back in my profession, and I'd probably be in more compromising positions. So I think the biggest thing that I've learned from this is really the importance that of what we're really building is also on the employer side. And I encourage more and more people to think about their industries. If you're in a position as an expert, how do you put yourself in the position to protect new younger, employees, especially dads out there that are young dads that need to provide for their families. Like, how do we build for them? So that'd be my final note.
Awesome. Good place to end. Okay.
Yeah.
Thank you for joining us today's episode of Vocation Business Leader Podcast. We hope you found inspiration as we explore the powerful union of faith and business. If you enjoyed the episode, please subscribe, share it, and leave a review. Your support helps us reach more faith-driven leaders. Until next time, may God bless you. See you next time.